at the beginning of July. So, but we have been seeing that has been declining since early July, which is good news. So while models are showing that there is still community spread, the trends are not discouraging. I don't think anybody's ready to say they're encouraging, but they're not completely discouraging here in the city. So, and with the rate of transmission, the city is really looking for that to be below 1 for a sustained period of time. So not just 1 or 2 days, but for a week and more, to really feel like they have a better handle on the spread of COVID. So as far as the current restrictions in place, masks are required in public unless you're exercising. Gatherings inside are limited to 25 people. Gatherings outside are limited to 50 people. Essentially all bars, or most bars in the city, are closed. The state has prohibited on-site alcohol and food consumption in bars. And the city has prohibited drive-through, takeout, and curbside alcohol sales. So, restaurants, bookstores, libraries, movie theaters, beauty and nail salons are all open at limited capacity. So there's stuff open in the city, but again, bars are essentially closed. There's limits on gatherings and masks are required. Briefly, Tulane has been working closely with the city on reopening. President Mike Fitz and Dean Tom Levis both sit on the city's reopening panel. And Dr. Levis is also on the state's reopening committee. And then in addition to that, President Fitz has been working closely with the other university chancellors and presidents here in the city on reopening and assisting the city in all of that. So we are in close contact with not only the other local universities, but also the local governmental officials.
And I would just add, this is Erica Woodley, I would just add to Lauren's sort of overview of the current state of things in New Orleans, that a couple of things. We've heard from many parents who are concerned about the Louisiana numbers that you see, and the things that have been coming out from the CDC and the White House about Louisiana in particular. And I think one of the things that I want to be really clear about is we're aware that these numbers are concerning, and we're watching them, but we are being advised that they're moving in the right direction, and we are taking really our city and state have been taking really aggressive measures in terms of getting them back to the place that we want them to be. And city and state are both still very supportive of our return. So we're optimistic about all of that.
And one more point on the numbers. The numbers from the state vary from, region to region within the state, but I would encourage folks to look at the city's dashboard. The city of New Orleans recently updated their site. I think it's easier to understand and look at where they're trying to go using their site, and they're using the same numbers, but it's just broken down for the city, and they I think do a great job of really breaking it down and putting it into a little bit more of English and not too sciencey for those like me or liberal arts folks. But you can find that at ready.nola.gov/data. So, and we can post that later in the slides for everybody as well. But it's a very easy to use and accessible website with the numbers that are updated daily by the city.
So, hi, I want to talk just a bit about our public health expectations on campus, which is really a cornerstone of our comprehensive reopening plan around our public health strategy. So we will have we're requiring daily symptom checks of all faculty, staff, and students. We actually started that program with staff this week. Text message is being sent. You'll click a link and it'll run you through the most common symptoms related to COVID-19 and be able to respond to that. Students and our faculty will start getting those texts on Monday. So if you're a student or a parent of a student watching this, and please respond to the text. It is legit. It is really from Tulane. I get a lot of questions. Is it spam? It's not. We will be texting you and asking you to remember to do that. If you go to our website, the daily symptom check is available there. You can actually print out a paper version of it if you prefer to do it that way. So we've tried to make it as easy as possible. We also are practicing social distancing on campus. Social distancing is right now 6 feet apart in all areas. The classrooms, meeting rooms, dining areas, all of our spaces on campus have been designed to promote social distancing. I was in one of our testing centers today. We have a queue set up so that everyone who's waiting for their test can stand 6 feet apart. We have similar protocols in the health center now. So social distancing is a really important piece. Face coverings are required. We will be providing all students, or we have purchased for all students, 2 face coverings, Tulane branded. So face coverings are required in all common areas and when you're with other people. So if you're walking between classes when there are lots of people out, you should have a face covering on. If you are in your residence hall room or your personal room in your residence, no face mask required. If you're eating, no face mask required or face covering required. But any other time, you should have a face covering on, and you should be ready with one in your bag or backpack just in case. We also will have face coverings at various locations around campus to help. I can tell you it's really easy to walk out and to forget your face covering, but we are trying to put those in strategic places to facilitate that. Hand washing, of course, a key component to the health and safety protocols. We have positioned hand sanitizing stations throughout campus, so there's additional hand sanitizer available, residence halls, lots of our main buildings, entrance and exits in different various places. So we've tried to make it very easy to clean your hands. Hand washing and face covering are to me, one of the most critical pieces of this. I think they have the potential to stop the spread more than any of the other items that we're talking about in some ways. We know that COVID is primarily spread through close personal contact. The other, I think, major piece, and I know that there were probably a lot of questions, is participation in our testing program. Testing is a requirement. We are testing all students, both those who live on campus and off, and our graduate and professional students, in addition to all of our faculty, staff, several of the large daily contract worker groups on campus as well. So we will be testing over 20,000 people between now and August 19th, and then on August 19th, we will begin again. Participation is mandatory. It is not an option. Not participating would result in action through the Office of Student Conduct, which we'll talk more about later. We also will be doing contact tracing. So if we have a student who tests positive or a faculty or staff who tests positive, we will reach out to that person, get some information, help coordinate their care, make sure they have isolation or quarantine space, and find out who they were in close contact with. So we'll be reaching out to all of those individuals, coordinating for testing or whatever needs they might have. Contact tracing is a mandatory requirement for being back on campus. So if you call because you've had a positive test, be ready to participate, because we want to be able to make sure anyone who might have been exposed would get contacted. So to break down our testing program in depth, we're doing a variety of pieces. And so the testing program is quite large, as I mentioned. Our surveillance testing program means that we're testing everyone as they return to work or campus before August 19th. The program the surveillance testing started this week in earnest. We sent an email out to the entire campus yesterday with basic directions. You will all be receiving a secondary email with the instructions on how to select the date and time for your testing. As an off-campus student, you can get tested now. I encourage you not to wait. So if you've received an email with a link to schedule, go ahead and make your appointment. The testing center uptown is located in Patterson Residence Hall, the lobby, but you do need an appointment with a date and time selected to go to that. We also have a downtown testing center as well. But please select a date, time, and get tested. You are required to do that prior to classes starting on August 19th. Please do not wait to the day before. Once you've got your test done, you show up, it's a swab in your nose. It's a very short, looks about the size of a Q-tip. You'll actually be swabbing yourself. You'll receive results in about 24 to 36 hours via email. This is a special process that was developed through the School of Medicine, and working with Campus Health, we facilitate getting you there and getting your results to you. The School of Medicine lab processes the test. So again, watch your email, make sure you schedule as soon as you receive that scheduling link. We also are doing our daily symptom tracker. Those texts started this week for our staff. On Monday, students will begin receiving those emails. Please start doing the symptom tracker. I talked about contact tracing in depth, but just let me walk that through what that might look like for you as a student. If a student tests positive, the contact tracer will call. They'll determine whether you can stay in your residence or if you need another place to isolate so that you don't expose your roommates. If you live in an environment where everyone there that you live with has been exposed, you could potentially stay in your own home. We just have Patterson as an option for you if necessary. We'll find out who you've been in close contact with. And close contact in contact tracing terms is someone you've been around 15 minutes or more, closer than 6 feet. So you've had some real proximity for a long amount of time. That would not necessarily be everybody in a class, wouldn't necessarily be everyone that you live with in your home. But we'll determine that. We will contact those individuals for testing. We will not disclose that you tested positive. We just say that you were a close contact, and we will facilitate those individuals getting tested. We'll work with you on all the actions and necessary what you might need to do to help manage class. We'll be linking you up with our case management and victim support services. So we have a whole sort of support system in place for that as well. Wastewater testing will also be done on campus this fall. So we'll be looking at wastewater, which takes samples of sewage, looks for COVID virus. That can actually help us pick up an outbreak about a week early before the testing would. So we're excited about that. And then we also have an illness reporting form. If you go to the COVID website on the Tulane COVID website, there's an illness reporting form. So if you get tested off campus, if you, for some reason, were tested somewhere other than campus health, you should file that report. It'll activate all of our services. We will reach out. We'll do contact tracing, make sure you have isolation or quarantine space if necessary, and make sure that you get the follow-up that you need. So really check the illness reporting form out. If you hear about a friend and they don't want to do it, you can do the report for them. But please take a look at the website. Lots of information on all of these pieces. All of these services that we have available will allow us to look at our data comprehensively to understand what's going on. The symptom tracker, for example, if I had a lot of people who reported symptoms and they were in a certain building on campus, I could change our testing queue and get those individuals in earlier. If I see a lot of off-campus students reporting fever, we might do some special messaging or change testing patterns. So it's really important that you participate in all of the pieces that we've offered to help us manage this effectively. So if a student tests positive, there's a couple of options. Self-isolation is important. It's not an automatic 14 days. Right now, it varies. So we use language a lot called working with your healthcare provider. If you're in New Orleans, Campus Health will be your healthcare provider. We'll coordinate whatever care that you might need. The Patterson Residence Hall was pulled offline. We have isolation and quarantine space there. So if you're unable to stay in your off-campus residence, we can move you there. You have an option to stay in your own residence if it's safe and your roommates or housemates are okay with that. You can also make other arrangements. We've had a lot of parents ask, if my child has COVID, can I come and take care of them? Yes, we would love for that to happen. So people can really have options. We aren't going to lock you into an isolation space in Patterson. We're going to work with you to make sure you're in the best place for yourself. Patterson is a great option, though. It is for students who are able to take care of themselves. If your illness is such that you can't, get up and go to the bathroom or feed yourself or do most of the activities of daily living, that's not the place for you. We will do food delivery there. We have nurses who will do multiple daily checks on the space to make sure you're doing okay, check vital signs to make sure that your symptoms are not getting worse and that you're improving. And we will coordinate all of the things that you need in Patterson. We'll also work with you to return to campus. So our physicians will be monitoring your care and give you a clearance when it's safe for you to go back to class and engage in other activities on campus outside of the isolation space.
Thank you, Scott. Now I'll talk a little bit about the behavioral expectations that we have for off-campus students. I know many of you have been in touch about this and have heard about this. And let me take a step back. I know Some of our language has been strong, intentionally so. But I want to draw a distinction. We've been working with a committee over the summer comprised of students and staff to look at a plan for how we enforce these behaviors and how we make sure that our community is accountable. And I think to start off, one of the things that we really wrestled with is the idea of, this is something new for a lot of people. We have students coming from all over the country, and it seems a little more commonplace now where people are, accepting that masks are a requirement, that kind of thing. But there are still pockets where that's not the case. So, the idea of making a mistake, and like if someone comes to meet with me in my office and they don't have a mask on, they'll be reminded, and we'll give them a mask and they'll put the mask on. So, we're allowing for those kinds of like learning curve mistakes. We'll still have an educational conversation about it, but they're not going to be, booted off campus if they make one small mistake like that. It gets increasingly more severe if they continue to, to forget to comply. That would be a problem, and there would be kind of a progressive situation of discipline. Where the real trouble comes in is if the idea of like willful noncompliance. And so there are only a handful of examples that I can think of that really fall into this category. One would be a student who just refused to show up for testing or refused to participate in contact tracing. Those two things are, public health dangers. And so what we would do is place those students on interim suspension. We would do a parental notification. So you'd be hearing from us about that. And then take the case of the not showing up for testing. If they refuse to do that, they would be internally suspended until they got the test. And so Dr. Timms mentioned that they have these extended hours of testing. And so we're trying to make it really easy for students to comply with this stuff. And so, those are two examples of willful noncompliance. The other big example, and this is one that I think makes everyone very nervous. I think people our faculty and staff, and even students, frankly, are really nervous about student behavior off campus. And so, the idea of hosting a party, we've told students to limit their off-campus gatherings to 15. And we chose that number because a lot of our students live in larger houses, and, you could have to 8 people living in a house, and each of them has one guest, and you're already at that limit. So, but we chose it, intentionally lower than the city because we want students to have an understanding of what we're trying to recommend here, which is we want kind of like how in Louisiana initially they were saying, you should really only hang out with your household. And so it's like that, basically. You should have your pod of people or your cohort of people that you're seeing, and try to limit your interactions to kind of a smaller group of people. Now, we know there are going to be challenges around that, but that's what we're encouraging students to do. And when they're in contact with other people outside of that, to be extra careful and make sure they're in a situation where they can be socially distant and wear masks. So the notion of how we're going to enforce all of this, I think it keeps people up at night. But I can tell you, in my 18 years at Tulane, one of the things that has been nice to see, this sort of the silver lining of this, is that students are really stepping up and holding each other accountable in ways that I haven't seen during my time at Tulane. So people are calling us and saying, my friend's thinking of having a party, and it'd be great if you'd call and talk them out of it. Or sometimes it's, after the fact or during the fact, and they'll say, this party's happening at this time, and we want, they're calling they've always called TUPD about things, but not really to report parties and this kind of thing. And then they're also holding each other accountable directly. Like you'll have students who confront another student and say, you need to wear a mask, or, we're seeing this stuff happening now. And so I'm hopeful that will continue when students come back. And I think the thing that we have going for us, number one, we have incredibly bright students. We have students who I believe have the capacity to make good ethical decisions. And when they understand, what the stakes are and what consequences, not just personal consequences, but what consequences could arise from their behavior, I think they can make good decisions. And we've seen that so far, and I'm encouraged by that. So, whoops. So these are some of the things that we expect the students basically have to comply with all of the, our specific policies, but also the city and state policies. They can't host gatherings of 15 or more. Student organizations are a bit different because we have some oversight of those, and those things will be happening on campus. So those more so mirror the city guidelines. So 50 people outdoors, I think that's slightly lower than this. I think the city's at 100, but 50 people outdoors and 25 people indoors. They need to keep things orderly and neat. This is a problem that we have, by the way, not just during COVID times. We have people off-campus students who struggle to maintain their trash in a way that's not all over the block. But it's even more important now because people are really sensitive to, hygiene and keeping things clean. Also, as Scott mentioned, it's just an important thing in terms of keeping their residences clean and disinfected. We actually have a guide that we created for off-campus students. Penny linked it in the email for this webinar, but it's essentially a COVID guide for students. And I know you all should have gotten Lauren, the guide that Lauren's office prepared about just general off-campus living, but we created one specific to COVID. And if you haven't had a chance to review that with your student, I definitely recommend it because it's got some really good tips. And then the last one is, and this is something that will at least be in place for the fall, off-campus students can't visit on-campus residence halls. And really, on-campus students can't visit residence halls that aren't their own. And the reason behind that is just to limit the amount of kind of cross spread that we might have. And so that's in place for now, and we're open to revisiting that after we see how the fall goes. But for now, we're kind of trying to limit that kind of interaction. And then I talked about this, but it's just really like 3 levels of severity. So, the low, the things that were, maybe you forgot something, or, your roommate complains that you're not being clean. We'll come in, we'll have a conversation with you, and we'll try to, to correct the behavior. Something medium would be, kind of continuing to make the same mistake. Eventually you're going to have, the stakes are going to get a little higher. And then the high severity is the stuff that I talked about, doing things that put other people in danger. And that's not a departure from our current code, by the way. Like, this is something that we've always had in place. If your behavior endangers others, you have more severe consequences, including, in times you can't be part of our community. So I would also say in all of these matters, there's due process afforded to the students. So we're not just automatically kicking people out. They get the opportunity to explain to us their side of things. But I think it's important for our students to understand our position on this, because I've been at Tulane for a very long time. It feels like forever, but a lot of members of our community view our students as, sort of people who come in and they consume and they use and they don't give a lot back, and then they leave. And this is a time when we have an opportunity to change that perception based on, bringing our students back and having them show our community what they're really all about. So I'm hopeful about that. Like I said, students are already reporting problematic behavior, but if you as parents hear of problematic behavior, or think that there are things that we should be aware of, including, as Scott mentioned, if you hear that, or if you feel that like your student's roommate tests positive and you don't know that it's been reported to us, you can always let us know. The concerns form is one way. Scott, what's the address or where can they find that link?
If they go to the COVID website and they look for the illness reporting form under the public health strategies, it's there. It's not an easy to find link, but if they go to the public health strategies, scroll down, there's an illness reporting form link there.
And I'll add it to this PowerPoint before Penny posts it, just so you can have all these resources in one place. You can always call the TUPD non-emergency number, and then if you're local, or if your student asks about reporting some of this, they can also call 311 to file this report. That's basically reporting it to the city. And the city's been following up aggressively on these reports. So I definitely encourage that to report in that way as well. Now Lauren's going to talk to you about some general neighborhood relations things.
Yes. So as Erica mentioned, that in addition to the COVID specific regulations, the longstanding code of conduct and city ordinances, state laws all still apply. Now, the university's return to campus COVID website is still and will remain the primary source for COVID related information at Tulane, but the government relations site, we did go ahead and add the COVID off-campus guide that Erica mentioned. We already have the regular off-campus living guide on that site. So that is just one place where you can find both the regular guide and the COVID guide for off-campus students. Your student should report their local New Orleans address. This is something that's required, I think, in Banner, but we generally highly encourage this for a lot of reasons in normal times, but even more so now. So a couple of the things that neighbors are home now more often and will likely be much more attentive to. So as Erica mentioned, trash. Trash needs to be bagged and disposed of properly. Depending on which side of campus your student lives on, trash could either be picked up, if you're on the Broadway side, the west side of campus, trash is picked up on Wednesdays and Saturdays and recycling on Fridays. If you're on the Calhoun side, the east side of campus, trash is picked up Tuesdays and Fridays and recycling on Thursdays. You may have read that, about one of the garbage contractors is their employees are striking, but trash is still being picked up. So the rules still apply for trash pickup. The guide goes through a lot more detail on bulk trash and other specifics related to trash and recycling. Parking is, especially on the west side of campus, on the Broadway side of campus, is an issue. Neighbors are right now very fired up about parking. That's related to some recent developments in that area and conversions of homes into high density properties. But parking rules are also outlined in the regular guide. I would stress to recommend that if the block has any sort of parking restrictions posted, to please have your student get a residential parking pass that they can get for the semester from the city. That's also outlined in the guide, but don't block driveways, don't block fire hydrants. Make sure you park with the flow of traffic, not against it, stuff like that. So again, those are all outlined, and the guide, you can access it online, and it has links to the city's site. Many of you may have received the guide in the mail recently. That did go out to juniors. That went out maybe a week or so ago. Sorry, my time is a little off. And then the last thing I'll mention is the city's noise ordinance. We kind of generally tell students that there are quiet hours, and there are quiet hours, but really the noise ordinance applies 24 hours a day. So noise should not be audible in a neighbor's home. And just given the way some New Orleans residences have been constructed over time, walls are thin, homes are close together. You can see a great example in the picture on the slide right there, how close those houses are. So it's just something to keep in mind. And again, I cannot stress how sensitive the neighbors are to these issues. And I think even more so now that so many of the neighbors are also working from home. So just something to keep in mind, that they will be paying attention to this and be calling addresses out to the university as well as to the city.
Kirk, I know we didn't talk about this, but would you mind saying a little bit about just general safety? Because a lot of these parents have students who are newly off-campus residents.
Sure. For the most part, the campus community, the campus itself and the surrounding neighborhood is very safe. We do stress for the students that are living off campus and on campus as well. Just some common sense safety tips. Lock your doors, secure your property. On the campus, the biggest thing that we really deal with is unattended property, leaving book bags, computers, those type of things out. Off campus, it's locking your doors, locking your car, just some simple common sense approaches to securing your property and your belongings. We do have a community policing liaison. His name is Roger Barnes, who does go out if any students would like, and does safety assessments of off-campus residences. He will make suggestions about things that they can do to improve the safety of the space that they're staying in, share with them some resources, such as keeping or identifying property through a program that we are partners with that kind of tracks it for them. And if it's recovered, it identifies them. But there are a bunch of resources that he'll share with them as well. We continue throughout the year to do tabling on the campus, try to get out as much as possible with events where we can kind of talk with the community about safety and safety practices.
And the only thing that I would add is, even if your student has something off campus that happens that warrants a call to NOPD, my preference is always that they also call TUPD, just so we can, be there to support them and have, know what's going on, kind of. So, thank you.
Eric, it might be a good idea for me just to also mention that the police department not only patrols on the campus, but in our patrol perimeter, which is a mile outside of campus. So we are authorized to patrol in that area, and we work very closely with New Orleans Police Department. So uptown, we're looking at Carrollton Avenue to Jefferson, and from St. Charles to Claiborne.
Great, yeah, thank you. So that wraps up the formal part, and now we're going to go to questions, but I'm going to stop sharing my screen. All right, guys. So the first question is for Scott. Scott, are there charges associated with an off-campus student quarantining in Patterson?
So no, Patterson was set aside by the university. I'm able to use it however I see fit for whatever students are necessary. There's no charge for that. There's also no charge for the testing program. Can I talk just a little bit more about testing? There were a couple questions to clarify. I saw, I want to clarify about the self-swabbing. I know that there were some questions about that. Students are not self-swabbing on their own. They're doing it in front of one of our observers who shows them how to do it to make sure that it's collected correctly. So that is done under observation of a healthcare provider at the testing center.
Scott, this is also for you. Will Tulane be publishing statistics on COVID positive likely cases on campus? If so, how frequently will that be happening?
Sure, we're working on we've built the webpage. We're just trying to work on pull the data together. Right now, our testing program has been using several different systems for reporting purposes, so it's been a little difficult to get it into one place. But our goal is to provide number of tests done on campus through our program and the number of reported positives that we have through that program or from outside test sites that Tulane students report to us. We've been tracking the number of cases that we have already. We're just trying to confirm and clean that data up. We plan to update it on weekly, most likely Wednesdays, once the data goes live. And I can also just say right now, our numbers of confirmed positives among the Tulane community are very low. We've had a lot of people think they had COVID and report it to us, and then we do some work to help them get tested or access. And actually, we've been very lucky, I think, as a community to have not had significant numbers of COVID break out. We've had very few students who've tested positive, and we're talking probably less than, since the beginning of this in March till now, probably less than I'm going to say 30 to 40 cases total.
Kirk, this one will be for you. Is the boot currently closed?
Yes, it is. With the current restrictions that the city has on bars, the boot's currently closed, and they will not be able to open up until the city determines that they can go to the next phase. Now, even with the next phase, there may be a carve out for bars. We're not really sure, but it would be at the next phase that they'd be allowed to reopen.
And I would add, Kirk and I meet regularly with both the owners and the people who run the boot, just to try to manage that relationship so that they're able to, I think, take feedback from us, and we help them where we can in terms of making sure that our students are safe. This question says, one of my son's classes says lecture tech enhanced. What exactly is that? And so basically that is, they should all eventually say either online or something tech enhanced, because it's indicating that all of these classes are able to be, like if your student gets sick, they don't have to go to class. We want to really encourage students when they're sick to stay home. And so this just means there's a portal or an online portion so the student can keep up while they're making sure they're well. I think I think Scott answered that one. Scott, this is a question. If my student gets to campus on 8/13, is there time to get tested? Is there still time to get tested before school starts?
Sure. So the email that the student will receive in the next couple of days, if they haven't already, will allow them select a date and time. So if they arrive on 8/13 early in the day, or even the day before, they can pick a date and a time that works for them to go over to the testing center for that. We get 24 to 36 hour results. So if they arrive on 8/13 and they make their appointment for 8/14, they should be fine. I encourage anyone, again, for students, if you're already here, get your test now. Don't wait to the last minute. There are plenty of testing appointments between now and 8/18 with classes starting on the 19th. So.
Scott, I think a lot of these are going to be for you. If a student is sick enough to need some help, but not sick enough to be hospitalized, should they go to Patterson?
We would work with them, but yes, Patterson would be perfect for that sort of a situation.
And then I think there's some confusion. Can you clarify the email? I think some folks thought that the email that went out yesterday had the testing link. That's not accurate, right?
So it depends. There's two emails. There was a community-wide email that went out that had basically the information and said, watch for a second email. The second email is specific to the individual, and it will have the link to scheduling. So if you haven't gotten an email with a link to the scheduling, it will be coming in the next day or so. We're loading everybody into the testing system right
now. Again, Scott, sorry. Can you talk about how you're working with athletics in terms of notifications and making sure that you're looped into what's happening over there?
Sure. So Greg Stewart is the team physician, and I've been working with him. We have a weekly, sometimes bi-weekly call to discuss their protocols. Athletics right now has a more stringent protocol for testing everyone there because of the type of the type of activities that they're engaged in. It's just a much more high risk. So they're tested more frequently. We are in active conversations about what that will look like as we go forward. The guidelines for athletics will change based on what phase the city's in and what also their national organizations are saying. So we work with them. They're getting sort of more frequent testing based on their need. There's a couple of groups on campus. I'll say healthcare providers are one. We're testing staff at campus health more often. So testing protocols are developed based on the risk of the individuals. And in that scenario, they needed more frequent testing. We monitor that. We work with them. I know if they test positive, we isolate, quarantine. We do all of those things in collaboration.
Kirk, I think this one will be for you and I together, probably. What is the difference between students gathering off campus and going to the boot? There will be hundreds of kids in the boot on a nightly basis, but students have to make 20.
Yeah. So even when they do open, there will not be hundreds of kids inside the boot.
Or outside the boot.
Yeah, the city is only going to allow a certain % of capacity for the establishment. I believe if they were to open up, they would probably start at 25% capacity. And we have both, Eric and I have both talked repeatedly with the boot, And if and when they do open up, they, at least at this point, are saying that it's going to be 21 and over. So you're going to have to be 21 and over to even get inside.
I think you addressed this, Scott, but we'll go ahead and ask it again, just to make sure everybody's clear. An off-campus student who tests positive is eligible to stay in Patterson for self-isolation, right?
Yes, they are. We will work with off-campus, on-campus, graduate and professional students.
This says, I'm an alum, a parent, and a nearby resident. What if a student hosts an outdoor party at 50 and claims they're an organization? So there's a process by which you have to register your events. And so you couldn't simply do that. You'd have to do some pre-work. And I think we'd probably be able to figure out if they were or not an actual organization. The other thing is, I think if you have people in an off-campus setting, there are still requirements, the city, even for, the events that are approved, we still have city requirements in terms of safety monitors and things like that that would have to be upheld even for approved events, but we wouldn't approve an event at a private residence in that manner right now. This one maybe is for everybody. Students picked housemates as early as last fall. My student is concerned that her housemates might not be as vigilant or as compliant as she plans to be. Any suggestions on how to address this within the shared living quarters? I'll start. My advice is to be really, really open about this to have, sort of an open conversation about this with your students have an open conversation with their roommates from the beginning, and set, really clear expectations about what is and is not okay with them. This has happened already. And, some people have made decisions to leave situations or to separate, which I know has complications from a lease perspective, but I do think it's better to know kind of what the agreement will be. We're happy to help facilitate those conversations and to have conversations with students who feel like some of these regulations aren't important to them. We can be helpful in that way. Again, developmentally, not really in a punitive way, but kind of proactively. Does anybody else have anything they want to say about that?
I actually think that the off-campus COVID guide is a really great discussion tool that roommates could use to talk about how they divide up tasks, what the ideas are. I think sometimes it's just having a conversation about those expectations, and that guide really lays out all the things you need to do to protect yourself in a common living arrangement. So I would really recommend looking at that and using that as an opportunity to have that conversation with your roommates so you start in the same place.
We also developed, you just reminded me, like a guide for having difficult conversations about this stuff. And it's less geared towards roommates, but more geared toward just like kind of friend relationships. And that's another good resource. Scott, this question is about, is testing outside of the Tulane community, like if someone goes to another place to be tested, are those results reported to you? Oh, wait.
So no. So for the surveillance testing program, we require that to be done online. You can't go somewhere else. If you're sick and for some reason you go to an urgent care or you have a local healthcare provider that you prefer and they test you and you test positive, you can report those to us through the illness reporting form. You can actually upload the results. That way we could activate services and we could work with you on isolation or quarantine if necessary.
And then I think I read the question wrong, actually. You're reporting your data to the city?
Yeah, so we will be working with the state for reporting all the testing and the positive cases. That's a process that's in place. We'll also be coordinating contact tracing. So our program really focuses on contacts within the Tulane community. So if a student had contact with someone outside of here, we'd be working with the state contact tracing program to do that.
Great. How do off-campus students report their New Orleans address? Actually, we made it very simple for them this year. They have to, when they go in to confirm their registration in Gibson, which is something that they all have to do, they'll have a prompt that'll, like a pop-up will come up and they'll be asked to enter their local address. I think the problem is a lot of students don't understand what local address means. And so I think this year we added a little asterisk or something that says, this means where you live in New Orleans. But if you could just make sure that they do that, that's super helpful for a lot of reasons. We've had situations where we have emergencies with a student off campus and we need to be able to go check on them and find them and their address is the wrong one. So this is really an important thing Scott, if a student has a negative test in New Orleans this past week, can that be used as the initial testing, or do they have to be tested again with Tulane?
If they have to be tested through the Tulane testing centers to meet the requirements for the surveillance program and for movement or class attendance.
Hold on. Can students get the antibodies test through the school?
We will be offering antibody testing. We have not set that protocol up. We need to get through this first round of just their basic PCR, the surveillance testing that we're doing. We will offer that sometime after the semester starts. Just want to clarify too about when I've got a lot of people ask about why we won't take outside results. One of the issues that we're running into, and we've seen this with a lot of our employees, is that there are a lot of people doing COVID testing in the city, and those tests vary in quality. We actually had an employee who went to get tested and then called us afterwards. They had to pay a lot of money for it, and they were told the test was only 50% accurate, which is not worth getting the test at that point. So we've put that rule in place because of the variability in testing, and a lot of places are offering tests that really are not good. So we wanted to assure the fidelity of our program with using our test. Our test was developed by School of Medicine, so we have really good faith in it.
Scott, this is another question that we talked about earlier. So for students who are traveling in, flying in, or coming otherwise, do you recommend any kind of quarantine time before they travel?
Our recommendation before travel to New Orleans is, to limit as much as you can, monitor your symptoms, wear your face covering, wash your hands. All of those core public health strategies, you should be doing those before you come here. I think while traveling, making sure you think about airplanes and common areas like that. I think travel is tough, but having your hand sanitizer, having sanitizing wipes if need be, those sorts of things. If you can quarantine, that's great. I just know that that's not realistic for a lot of people in this environment right now. So I think do the best you can, but follow those other principles and you'll be good.
We're getting a lot of questions about remote learning. And so to clarify, if a student designates themselves as a remote learner and they're taking all online classes, that's really put in place for students who are uncomfortable coming back. And we wanted to have a flexible kind of plan so that they could not return to New Orleans if they wanted to. So we're getting questions about, if you're in New Orleans and you're a remote learner, because there are restrictions for remote learners in terms of their access to campus. And the reason for that is because they're not part of the testing protocol. And so they can't come to campus. Now, if they are interested, if their classes for some reason switch to remote learning and they didn't actually opt into that, they can work with their academic advisor to not be a remote learner. And they can, have in-person classes that the advisor can work with them to make some changes that will accommodate their kind of academic needs, but also allow them to be part of the campus community. Scott, can you talk about the frequency with which students will be tested? I know you talked about that a little bit, but there seems to be a little bit of confusion about it.
So we're testing everyone now between now and when classes start. Beginning on August 19th, we will be testing everybody monthly. And that equates to we'll be doing a random selection of students, faculty, and staff every day. So it's about 5% of our total population will be tested every day beginning August 19th. And then beginning September 19th, we'll start over. So we'll be testing everybody on a monthly basis.
This one is, will there be any restrictions on non-students or staff entering campus? Yes, we are, the president has made it public that our campus is closed for visitors, basically. So, no one will be on campus without a specific need to be on campus. And to that end, we've had a cooperative agreement with Loyola for a long time where, our students went there and they could come here, and we're putting that on pause for right now. So our students won't be able to use their dining hall. They won't be coming over here. And we've closed the library to non-affiliates and our Riley Center as well. So, we've made moves in the way of closing our campus for visitors for the semester.
If I can add or kind of clarify to that, while campus facilities, yes, are closed to non-affiliates, that does not mean that the neighbors cannot walk, run, or bike through campus. We would kindly ask the neighbors to not stop if they're non-affiliates. So if you're traveling through, like to go to Audubon Park or something, you're welcome to go through campus as you travel, but please do not stop. this time.
Scott, this is another, what, can you just say what, if this is if an off-campus student arrives on August 15th, will they be able to schedule a test? So to clarify, the test should be scheduled before August 15th. The scheduling part should happen before August 15th, correct, Scott?
Yeah, so they're going to receive the email. A lot of students got them today, but in the next few days, they will have the email. They can select their date and time for their test as soon as they get that. August 15th is fine.
Okay, and then there's a question again. There was a question about what's being sent via text to students, and it's this daily symptom tracker. So they'll get a text that reminds them about that. Scott, can you talk a little bit about how TIMS is being deployed to support our efforts?
Yeah, so Tulane EMS is our emergency medical service on campus. They will be in service early August. That date has just floated a little bit, so I'm not going to say which date, but by the time before classes start, actually, they will be doing a response to any sort of emergency situation. They have been trained and will be doing their back in service training in a few weeks, but they have PPE, any necessary precautions that are necessary. They're a really great campus resource and are great students. And so we're very lucky to have them to provide that sort of support and safety net for our students.
This is a question that's been asked in a couple of different ways, but essentially what accommodations have been made to help students have quiet places either to study for exams or to take online classes. And we have a number of kind of normal study spaces that are in play all the time. All of our buildings have been, kind of reformatted to accommodate what the social distancing recommendations are. But we also took a whole host of classrooms offline because they were too small to hold a class. And so students have actually more opportunities for those kinds of quiet spaces than they have had in the past. I think again, some of the smaller study spaces will still be available, but likely like a study space that previously might have had, the capacity for 4 or 5 people will probably now be reduced to 1 or 2. So all of that stuff has been changed. And so students will be able to know, what the capacity is for all of the different rooms. Yeah, so this is a question about kind of, you spoke to it earlier, Scott, but can you just say it again? What our tipping point is, or, when we would say we're calling this off?
Yeah, so again, there's not one factor that we would use to make that decision. There's a variety. We are constantly monitoring both the city and the state data related to COVID infections and positive tests. We also are looking at hospitalizations, how much capacity is there in the hospital. We would then also be looking at the Tulane data from our testing program, what we're seeing on campus. There's also a piece in there looking at it, and most of our students, what we've seen of the few cases of COVID here have been asymptomatic. So there's a huge piece there about managing. If we have a lot of asymptomatic cases, people are testing positive, but they're not sick, what would we do then? So again, all of those factors would go into play to make any sort of a decision. Again, we have protocols for when we would sort of trigger that and, make decisions based on the data that is available from a variety of sources. There's not just one number. I think everybody would like me to say, well, if you get 200 cases, you're going to have to shut down. And I can't, because it really depends on what everything else looks like in our capacity to handle them.
Guys, it looks like we're out of time. We will take your questions though and try to respond to them in the manner of like an FAQ that we could release to you, or if there's specific questions, we'll respond directly to you. Penny, do you want to wrap us up?
Yes, I just wanted to mention that the previous webinars that the President's Office has produced can be found on the Return to Campus website. And so this is a URL you may want to take down. That's tulane.edu/COVID-19 webinars. So that should take you to a page where you can access those recordings. It's if you go to just tulane.edu/COVID-19, the very first tab on the left is operations, and the webinars are listed under that drop down menu. So you would just go operations, then webinars. And then for parents, for the other presentations that we've done for parents, for those of you who are off campus, who parents of off campus students, your students are older. So you may remember that in the summer when your student was doing that transition from high school to college, we presented a lot of resources to you. So we have had a series that was advertised to those parents of first year students, but those are more of those general topics, and they're on our regular parent programs webinar archive. This one will probably be archived in both places. And on the parent programs website, we'll also have the PDF of the slides. And so we'll add some more detail to the, note some of those websites that Erica mentioned that we can add to the slides before we post them. So give us a couple of days to get the recording up and posted and all of that. It has been broadcasting live on YouTube. So on the parent programs YouTube channel, you also should be able to find it there if you want to watch it again. I would just say that it's a very, very important time for your student to be checking their email every day. And parents, we are also sending information to parents. So watch for those special bulletins or just the typical e-newsletters that we send on the regular basis. I think that's it. So thank you so much for joining us. And thank you to all of our panelists for your time and information and all your hard work this summer to get everybody ready for this return. Thank you.
Thank you.